Hi, and good afternoon, good morning, or good evening, or in the world, arthritis warriors. This is Dr. Jonathan Florlees. You can call me Dr. Jof, and I want to share a story. A lot of my patients who are very young, who have arthritis, is usually secondary to something, some disease, and a lot of these patients are showing up all over the Philippines. They actually formed a separate group, and I've been invited to this group. They are the AVN Warriors. So the AVN stands for Avascular Necrosis of the Hip. And today, I'm going to discuss the myths about AVN. If you are an AVN warrior, or if you have a vascular necrosis, if you are very young, probably less than 40 years old, and you already have severe arthritis of the hip or of the knee, this may be of value to you. So again, this is Dr. Jof here at the Cebu Orthopedic Institute. I want you to stay tuned because this is actually something that I've already done with them before last July 2021. A vascular necrosis of a hip is a condition when the bone, the head part of the femur, slowly dies. In the ball and socket joint, that is your hip, this head is the ball part of the femur. And this part can be affected, especially when there are changes in blood supply. And these changes can be caused by conditions in the blood, problems in the metabolism, certain diseases, and external factors like smoking, alcoholism, steroid use, too much oxygen, and sometimes metabolic disorders or endocrinopathies, and even certain cancers in the blood. The pain is severe that gradually starts in the groin, the bugan, and sometimes goes all the way to the back, and sometimes the inner thigh and inner knee. Good morning, good evening, and good afternoon, wherever you are in the world. Arthritis warriors, this is Dr. Jof. I'm recreating this forum that I did last 2021 with a special group, the AVN Warriors Philippines. If you know someone with osteonecrosis or AVN of the hip who wants to have a talk with others like them, join the group. We support each other. And these are Filipinos with AVN, young and old, in different parts of the world. Disclosures, I'm a consultant at the Cebu Orthopedic Institute. We've been serving since 1999, and we aim to be a center for world-class orthopedic care here in Cebu, in the Visayas, and in Mindanao. Now, I'm a member of the Philippine Hip and Knee Society, and let's go to our first myth. My symptoms in the hip are gone. Sometimes when you have a very, very painful AVN, there is a time where you have no symptoms at all, or the pain has subsided. And this is the problem. A lot of the patients think that because wala nang pain, wala nang sakit, then they think that their AVN is completely cured. This is actually one big myth, and I don't want you to misinterpret this. I want you to think about what AVN actually is. If a femur fracture, and a femur fracture is a break in the femur bone, like this one, so that's a crack in the bone, I compare this to something like a cracked car rim. Whereas when you have osteoarthritis, osteoarthritis is the worsening of the cartilage damage in the joint. I compare this to the wear and tear of a car wheel. But when you have AVN in the bones, osteonecrosis, what happens is slowly the bone dies from the inside. And what happens if this is a car wheel? It is a tire blowout. The nerves and the vessels inside the head are actually damaged, so the blowout is from the inside. And this is the thing. When you have a blowout from the inside, that thing that gives nourishment to the hip is gone. So it's a slow and painful, sometimes not so painful, bone death. There are going to be early signs, and there are going to be different symptoms for the car wheel. That's why I want you to realize not every patient has the same symptoms of pain. Sometimes the pain will be very severe for a while in the acute phase. That's when the bone starts to die. But later, it's really severe. It's going to be different feeling for each person. Some will have severe pain, others will have not so severe pain. So it doesn't mean that your symptoms are gone, that your AVN is gone. You may be going through a certain phase in your AVN, and there are different stages. The truth is, no symptoms does not mean no disease. I want you to be grateful and follow up with your doctors, because if you catch it really early, we can prevent this from worsening. Myth number 2, if your pain is severe now, you might need surgery. So it doesn't mean that you might need surgery if the pain is really severe, but you have different types of hip pain, and we have a scoring system for your hip pain. So we typically check the hip scores of the patient to determine whether the pain is really severe and if the pain and correlates to the damage in the bone. Because if the bone is very much damaged, maybe surgery is needed, but if not, maybe we can treat differently. So this is the Harris hip score. It has different scoring systems. Use of the aid is one, and that's the point. If you have very bad pain in the hip, it doesn't mean that you need immediately hip surgery. The truth is, the management will depend not on the amount of pain you have, but the stage of the disease helps as well. The pain will need to be documented, and also the stage that you are in. Now, I want you to write down, arthritis warriors or AVN warriors, what you feel during the times that you have pain, because you want to be able to describe this pain and correlate it, because later the pain might lessen or even worsen. We don't know. The occurrence, there is no specific occurrence, but mostly AVN happens in males over about 30 to 40 years, and the incidence around the world is unknown. The basic science is that you have a problem with the blood supply or with the blood, and this problem can be brought about by diseases like in the pancreas or lupus, which causes vasculitis or inflammation in the vessels. Alcohol, steroids, smoking are other factors as well. If you have trauma to the hip, that's something that can cause it. Infections and Kaison's disease from the bends or diving are other causes as well. Other things that can cause the AVN are blood diseases like sickle cell anemia, amyloidosis, Gaucher's disease, and radiation and rheumatoid arthritis. So the blood vessels can be have an occlusion, and this causes a problem with the blood supply to the head, causing the damage, and that's what AVN is. Myth number 3, if my bone is dead, there is nothing that you can do but take the pain. Really, the pain can be from the hip and sharp. It can be noticed that you have sometimes vascular symptoms. If you have vasculitis like nail bed darkening, in certain patients they have other vasculitis symptoms in different organs like the kidney. You can have a kidney injury, a brain, you could have a stroke, and even the heart can have an injury as well. So we want to work up these patients. Of course, it's going to be the baseline X-ray and MRI for the hip, but for the different parts of the body, you want to know as well. This is an X-ray. You don't really see the AVN if it's really very early. That's why we get an MRI. This is the same patient where you can actually see the AVN on the right side. That's really white. The FICAT classification will tell us if there is a collapse or there's already advanced arthritis. So the management typically depends on the type of pain the patient has and the FICAT stage. Hopefully this helps, because medical management is the first line before we go into surgery. Bone formation and breakdown happens daily. Avascular necrosis can be treated with a core decompression or a total hip replacement. We now do a direct anterior approach. That means no muscles are cut. And we remove the ball part and the socket part if there is already severe damage to the hip joint. Hope this helps, and hope to hear from you soon. Research is going into the different pains and stem cell research. We hope to see large advances in the future. Hope this helps you guys. Much love and respect. This is Dr. Jof. Remember that there's a way. Remember that you can inspire and help others. And share this with a friend or with someone who you know has AVN. This patient had severe AVN on his hip. He had groin pain and he was limping badly. He really needed the surgery, and what we did is the direct anterior approach to the hip. That means no muscles are cut, and some patients are out of the hospital as early as 24 hours, and he went home safely to his province where he recovered. So if you are someone with AVN, or if you know someone with AVN of the hip or of the knee, we want you to join us, message Dr. Jof, or come to the clinic for a consult. We are a group composed of Filipinos all around the world, and it's not just here in Cebu. Patients are coming from different parts of Visayas, Mindanao, and Luzon, and even abroad. Some of the patients have already been operated on. Some of them are afraid of surgery, but this is a nice group where we help each other and help encourage and inspire each other so that we can be warriors for AVN.